Welcome to PsychoMinds, where psychology is simple, clear, and science-based. Today, we're talking about consciousness. Consciousness is one of the most fundamental psychological functions of the human mind. In simple terms, consciousness can be defined as the state of being awake, aware of oneself, and aware of the surrounding environment. Through consciousness, human beings are able to perceive stimuli, think, feel emotions, make decisions, and act intentionally. In psychology and psychopathology, consciousness is not understood merely as being awake. It is a complex mental state that involves clarity, awareness of reality, and the integration of internal and external experiences. A conscious person can recognize who they are, where they are, what is happening around them, and how to respond appropriately. Consciousness serves as the foundation for all other psychological functions. Attention, memory, thinking, language, and emotional life depend directly on an adequate level of consciousness. When consciousness is altered, these functions also tend to become disorganized. For this reason, the assessment of consciousness is one of the first steps in psychological and psychiatric evaluations. Alterations in consciousness often indicate a global impairment of mental functioning and require careful clinical attention. Understanding consciousness is essential for understanding how the human mind operates and how many psychological and psychiatric symptoms emerge. Consciousness is not a fixed phenomenon. It can vary in intensity and quality depending on physiological and pathological conditions. In clinical practice, professionals describe different levels or states of consciousness, ranging from full alertness to deep unconsciousness. Normal wakefulness, also called full vigilance, is the state in which a person is awake, alert, and responsive to environmental stimuli. During sleep, there is a natural and reversible reduction of consciousness, with decreased awareness of the external world. Pathological states of consciousness include drowsiness, lethargy, stupor, and coma. In drowsiness, the person struggles to remain alert. In stupor, responses to stimuli are slow and limited. In coma, there is a near-total loss of consciousness and the ability to interact with the environment. These conditions are commonly associated with neurological disorders, intoxications, infections, head trauma, and medical emergencies. Correctly identifying the level of consciousness is crucial for determining the severity of a condition and guiding clinical decisions. The existence of different states of consciousness highlights its dynamic nature and its sensitivity to both physical and psychological disturbances. The relationship between consciousness and attention is close and inseparable. Attention can be understood as the ability to selectively focus on certain stimuli within the field of consciousness. Without attention, consciousness loses clarity and organization. When consciousness is preserved, attention allows the individual to select relevant information and ignore irrelevant stimuli. However, when consciousness is impaired, attention becomes unstable, fragmented, or absent. In many clinical conditions, attention deficits are among the earliest signs of altered consciousness. Confusional states, for example, are characterized by fluctuating levels of consciousness combined with difficulty concentrating and disorientation. Evaluating attention helps professionals assess the quality of consciousness. Impaired attention may indicate conditions ranging from fatigue and stress to serious neurological or psychiatric disorders. Therefore, consciousness and attention should never be analyzed separately. Together, they reveal how the mind organizes immediate experience and maintains contact with reality. Pathological alterations of consciousness represent a significant disruption of mental functioning. One of the most important clinical conditions is delirium, also known as an acute confusional state. It is characterized by fluctuating consciousness, impaired attention, disorientation, and disorganized thinking. Individuals experiencing delirium may present agitation, hallucinations, sleep-wake cycle disturbances, and difficulty recognizing people and places. This condition is common among hospitalized patients, especially older adults, and may be triggered by infections, medications, intoxications, or metabolic imbalances. Another important alteration involves dissociative states, in which there is a partial disruption in the integration of consciousness, identity, or perception of reality. Dissociation is often associated with intense psychological trauma. These alterations indicate psychological or organic suffering and should never be ignored. Early recognition is essential to prevent complications and ensure appropriate treatment. The study of altered consciousness is central to psychopathology because it reveals how the mind can temporarily or permanently lose its integrative capacity. Consciousness has major clinical importance because it reflects the overall level of mental functioning. Alterations in consciousness often signal that something fundamental is compromised, whether due to psychological, neurological, or medical causes. In professional practice, assessing consciousness helps differentiate primary psychiatric disorders from medical conditions that require immediate intervention. In many cases, changes in consciousness represent medical or psychiatric emergencies. Consciousness is also directly related to autonomy, judgment, and responsibility for one's actions. Therefore, its evaluation has ethical, legal, and therapeutic implications. Understanding consciousness means understanding how the mind remains integrated, organized, and connected to reality. Throughout this series, each psychological function will be explored with the same clarity and scientific rigor. In the next video, we will move forward to a detailed discussion of attention, examining its types and main alterations. Here on PsychoMinds, we explain psychology with clarity and scientific responsibility. Subscribe and be part of a community focused on learning and understanding the mind.